Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Clostridium perfringens, the leading cause of food poisoning. Clostridium perfringens, C.perfringens, is a type of bacteria linked to food poisoning. It is the most common cause of food poisoning in the United States. Symptoms of C.perfringens food poisoning last a day or two and include stomach cramps, watery diarrhea, gas, and bloating. /r/n/r/n Although C.perfringens food poisoning is usually not serious, the bacterium is also linked to more severe wound infections, such as gangrene, clostridial myonecrosis, and anaerobic cellulitis. C.perfringens is frequently found in human and animal intestines, soil, and in areas contaminated by human and animal feces. /r/n/r/nJacob Wackerhausen Getty Imagesrnrn If you eat food contaminated with C.perfringens, you may start to experience symptoms within 6 to 24 hours. The illness will begin suddenly and last between 24 and 48 hours. /r/n/r/n Symptoms of a C.perfringens gastrointestinal illness can include /r/n/r/n Food poisoning due to C.perfringens does not usually cause fever or vomiting. /r/n/r/n C.perfringens food poisoning results from eating improperly cooked and stored foods. Bacteria are typically found on food after cooking, and if the food sits out for an extended length of time before refrigerating, bacteria can multiply and lead to C.perfringens food poisoning. /r/n/r/n When you eat contaminated food, toxins will be released into the gastrointestinal tract, causing food poisoning symptoms. /r/n/r/n Outbreaks of C.perfringens food poisoning often occur in settings where food is served to large groups and it's harder to keep food at proper temperatures. Such settings include hospitals, school cafeterias, correctional facilities, nursing homes, and large events with catered food. /r/n/r/n Most outbreaks of C.perfringens food poisoning occur in November and December. They are typically linked to popular holiday foods, including turkey and roast beef. /r/n/r/n While food poisoning from C.perfringens can affect anyone, young children and older adults are at increased risk for severe illness from the bacterium. /r/n/r/n When food is kept at unsafe temperatures, between 40 and 140 degrees Fahrenheit, C.perfringens can grow and multiply. After the bacterium is consumed, it may produce a toxin that causes the host to become sick. /r/n/r/n Foods commonly linked to C.perfringens food poisoning include /r/n/r/n The symptoms of C.perfringens food poisoning typically resolve within a day or two. However, fatal diseases can occur in older adults and immunocompromised people, those with a weakened immune system from illnesses or medications. /r/n/r/n Complications may include dehydration and sepsis. /r/n/r/n Your healthcare provider can diagnose food poisoning based on your symptoms. It typically does not require lab testing or determine the exact organism responsible, although tests can be performed on stool samples or food. If there is a community health outbreak, public health officials may test possible food sources for C.perfringens. /r/n/r/n You can manage food poisoning at home, and the condition is usually short-lived. It is a good idea to keep yourself hydrated by drinking plenty of fluids as soon as diarrhea or vomiting starts. You can drink water or oral rehydration solutions like Pedialyte. /r/n/r/n Rather than taking over-the-counter, OTC, stomach remedies, wait for the food poisoning to run its course. Rest and consume foods that are easy to tolerate and digest, such as the brat diet: bananas, rice, applesauce, and toast. Eating small meals with very little fat can help you manage symptoms, stay nourished, and keep food down. /r/n/r/n. A primary way to avoid food poisoning is to take precautions when heating, storing, and serving foods. You can do this by /r/n/r/n. While food poisoning generally does not require medical care, you should still pay attention to more severe symptoms, such as a fever of 100.4 degrees Fahrenheit or higher, or bloody diarrhea. You will also want to see a healthcare provider if symptoms do not improve within 48 hours. /r/n/r/n. People with compromised immune systems, pregnant people, older adults, and people with other risk factors should see a healthcare provider for food poisoning. /r/n/r/n. For other types of food poisoning caused by bacteria or parasites, your healthcare provider may prescribe antibiotics or medications to target parasites. Antibiotics bacteria and cannot be used to treat infections caused by viruses. /r/n/r/n. Most people can treat food poisoning at home. However, you should seek out emergency care for more severe symptoms. /r/n/r/n. Severe symptoms of food poisoning that require a visit to an emergency room visit include /r/n/r/n. Gas gangrene is a rare bacterial infection that destroys blood cells and soft tissues. C.perfringens bacteria mainly cause it. If you experience a gas gangrene infection, your symptoms may include pain, swelling, and redness in the affected area. /r/n/r/n. Additional symptoms of gas gangrene include /r/n/r/n. If gas gangrene is not treated, it can lead to low blood pressure, kidney failure, or coma. /r/n/r/n. Anaerobic cellulitis is a bacterial skin infection. The symptoms of an anaerobic infection may vary based on the location and severity of the infection, but may include /r/n/r/n. In some cases, an anaerobic infection may not cause symptoms until it becomes severe and spreads to multiple body areas. /r/n/r/n. The Clostridium perfringens bacterium is the most common cause of food poisoning. This bacteria is found in the intestines of people and animals and is present in soil and animal and human feces. /r/n/r/n. This type of food poisoning results from eating improperly cooked or stored food or food that is not at proper temperatures. Commonly infected foods include meats, poultry, seafood, raw vegetables, and gravies. /r/n/r/n. Symptoms include abdominal cramps and diarrhea. They typically start 6 to 24 hours after eating contaminated foods and will improve within 24 to 48 hours. /r/n/r/n. Diarrhea and vomiting can lead to dehydration, so you will need to drink plenty of fluids, including water and oral rehydration solutions like Pedialyte. Contact your healthcare provider for more severe symptoms or if symptoms do not improve after 48 hours. Go to an emergency room if you experience severe abdominal pain or dehydration, bloody diarrhea or vomit, or a high fever. /r/n/r/n. You can manage C.perfringens food poisoning at home by resting, staying hydrated, and eating bland foods. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.